എന്നുവെച്ചാൽ ലൈവാണ്.
Am I audible?
Yes, Ruba.
The future depends on what we do in the present. Good evening and a warm welcome to all. I am Ruba Shosharoy from second year psychology, welcoming you all to the 13th section of Sci-Hub, the international webinar organized by the Postgraduate Department of Psychology and Internal Quality Assurance Cell of Kottayam College of Management and Technology. Just a little instruction before we get started. Please mute yourself to keep the quality of sound functional during the meeting. If you have any questions during the section, please type them into the chat box, which will be clarified during the question answer section. The link of feedback form will be posted in the chat box by the end of the meeting. Now, let's move on to our section. Prayer should be regarded as a duty which must be performed, but rather as a privilege to be enjoyed, a rare delight that is always revealing some new beauty. I call upon T.I.S.R. Thomas from second year psychology for the prayer song.
Am I audible?
Yes, Tia, you are audible.
There are numerous strings in your lute. Let me add my own among them. Then when you smite your chords, my heart will break its silence, and my life will be worn with your song. There are numerous strings in your lute. Let me add my own among them. Amidst your numberless stars, let me place my own little lamp. There are numerous strings in your lute. Let me add my own among them. In the dance of your festival of lights, my heart will throw, and my life will be worn with your smile. There are numerous strings in your lute. Let me add my own among them.
Thank you, Tia. Now I invite Ms. Kribadina Matthews, Assistant Professor of Psychology Department, to deliver the welcome speech.
Good evening, one and all. It's my pleasure to welcome you all to the 13th session of Sci-Hub International Webinar Series organized by the Department of Psychology, Kottayam College of Management and Technology in association with Internal Quality Assurance Cell. On the behalf of the department, I would like to extend my cordial welcome to the guest speaker of the day, Mr. Harikrishnan, Clinical Psychologist and Assistant Professor, Department of Psychology, University College, Trivandrum. Welcome, sir. Next, I would like to welcome our beloved principal, Father Joshi Chiranguril CMI, who is the inspiration and constant support for each webinar series. A hearty welcome to Dr. Varghese Anthony, the Vice Principal and Head of the Commerce Department, for being an unfailing support for all our academic achievers. Next, I welcome our dearest HOD, Dr. Angel Thomas, who is the backbone in guiding and motivating us in all ways. Welcome, ma'am. Next, I would like to express a warm welcome to the IQAC coordinators, Dr. Sushil George Joseph and Dr. Anu Anthony, for providing us with such a platform for us. Last but not least, my sincere welcome to all the department heads and teaching faculties and all the participants watching us. I wish this session to be a fruitful one and enlighten each of us with new knowledge. Thank you.
Thank you, ma'am. May I request Jiten Shaji Varghese from second year psychology to introduce our speaker, Mr. Harikrishnan Alingal.
Am I audible?
Yes, Jiten, you are audible.
Good evening to one and all. It's my pleasure to introduce today's renowned speaker, Mr. Harikrishnan Alingal, to the 13th session of Sci-Hub International Webinar Series organized by the Postgraduate Department of Psychology, Kottayam College of Management and Technology. Mr. Harikrishnan Alingal is a clinical psychologist and academician. He is also a platinum member of the world-renowned International Council of Professional Therapists. He did his graduation in psychology from MG College, Trivandrum, and has done his post-graduation in applied psychology at the University of Kerala, Trivandrum. Later, he went on to receive his MPhil in medical and social psychology at Central Institute of Psychiatry, Kanke branch. He has also published various articles, and one among them is titled as the dietary preference in relation to personality and temperament. And at present, he is pursuing a doctorate on the topic effect on self-regulation, habit, strength on defense styles, and well-being in adults. Mr. Alingal has achieved and worked in numerous posts. His journey began as a clinical psych specialist at Dr. RML Hospital in New Delhi in 2004, where he worked for a year, and then left to USA after receiving the Perpetuator Fellow, where he worked under the position pre-doctoral research scholar. Coming down to the lane among the various other postings, Mr. Alingal has also held the position of Chief Clinical Psychologist and lecturer at the NIMS Hospital, Trivandrum, and at present he is working as an assistant professor of the Department of Psychology at the University College, Trivandrum. Sir, on behalf of Christiodi family, I welcome you to the session. We are immensely happy and proud to hear from an esteemed personality like you. We are indeed looking forward to get enlightened with your views on violence in intimate relationships. Thank you.
Thank you, Jiten. Now, I invite Mr. Harikrishnan Alingal to begin the section, Violence in Intimate Relationship. Welcoming you, sir.
Thank you, Jitin. Thank you, Rupa. Thank you, the department, for giving me an opportunity to talk about this pertinent topic. Nowadays, it's very difficult to be in a family and settle down as a result of pandemic and other things. We are spending more time at home, and that has led to many devastating consequences in many of the houses. And so socialization has been got restricted, and after that our people are coming out with their innate self of the negative and positive things that they have, and ultimately who is going to undertake all these things is very important. And so family members are the first people, first line of contact, and they have to see what exactly the other person is behaving, how the person is talking, how the person is behaving at home. And from that, frictions happen, and it leads to many other consequences. So today we will just walk through all these aspects, and feel free to interact and ask questions. Won't be an issue as such. I don't mind people popping up and asking questions. So with that note, let us go into the initial part, like what intimate relationship is, what violence is, and most of the words or terminologies are well acquainted ones, but still as an introductory thing, I would get you introduced to all these terminologies. So intimate relationship, as you know, is an interpersonal relationship that involves physical and emotional intimacy. Okay? And it is mostly mentioned in terms of sexual relationship. It is quite popular when you say if it is intimate relationship, you have a predisposition to say that it is mostly a sexual relationship. But there are many non-sexual relationships which are very intimate too. So in that connotation, it is very important. There is emotional intimacy, which is feeling of liking or loving. And the physical intimacy is where the sexuality comes in. It is mostly like friendship, platonic love, romantic love, sexual activities and other passionate attachments are all included in the physical intimacy. You must be quite familiar with all these terminologies. Platonic is where you have non-sexual relationship, which is based on love and trust and other things. So that is Platonic love. Romantic love involves mostly, it is mostly into the libidinal aspects comes in. Sexual activities where you culminate in sexual activities, and there are many other passionate attachments which we can see in real life. So, so what is genuine intimacy? Well, there are 4 components to genuine intimacy, and that is dialogue is one of them. And dialogue is when two people interact and exchange words. That is a dialogue, and good words and good deeds are exchanged. Then it becomes a very wonderful way of going about with the family. Otherwise, or the relationship itself, there should be transparency. Transparency is where you trust the other person and expose your thoughts and expose your processing thoughts, emotions and behavior to other person without any restraint. That is transparency. Vulnerability is where you change yourself according to the situational needs and become amenable to change is vulnerability here. And reciprocity is what you get, you give it back also. So it is a give and take policy. So that is what reciprocity is. So in a wonderful intimate relationship, all these things are the 4 pillars in which the relationship moves on. So if there is any issues with all these things, so it's basically dialogue is when it's communication. Transparency is where that is trust. Vulnerability is ability to modify, and reciprocity is concern about others. So that is the 4 pillars in which the relationship rests upon. So genuine relationships move in these terms, and there will be good communication skills between the people who are having relationship, and they trust each other, they share each other's many things, and that leads to further strengthening of the bond. So what is the difference between relationship of there is 3 components to every relationship. That is, one is legal component, the other one is the physical component, and the other one is the psychological component. So there are 3 components to every relationship. The legal component is where when 2 people come together and live as a family, we may say that it is like when they register themselves as husband and wife, that becomes a legal bondage. There is physical bondage, that is when you have close intimate relationship, that is your personal space shrinks very much, and you include the other person into your personal space. That becomes more of a physical thing, and that is physical relationship. And psychological relationship is when you open your mind and your thought process and incorporate the other person into your other person's psyche into your psyche. That becomes a psychological intimacy. So these 3 components strengthens the family. So whether it is marriage, whether the 2 people are coming together as a result of marriage, or whether they are cohabitating, or whether they are having an intimate relationship, which may end up having a legal bondage. So these are all called intimate relationship. And there are many relationships which are they not culminate in marriage itself, but there are like there is strong mental synchronization between people that can be more of a cognitive kind of spiritual intimacy that we say. So emotional intimacy is where you have emotional linkage with the other person, and it can have many that is psychological, mostly psychological and emotional aspects that we deal with in genuine intimacy. Okay. So what is violence? Violence is an act which is committed by a person in order to intimidate or hurt or destroy other person's existence. So that is violence. So there is physical violence, sexual violence, stalking, and psychological aggression, which we will be going through. Okay. So physical violence is what is physical violence? When it manifests itself as scratching, pushing, shoving, throwing, grabbing, or biting, choking, shaking, aggressive hair pulling, slapping, punching, hitting, or burning, use of a weapon, use of restraint of one's body size or strength against the other person. Physical violence also includes coercing others to commit any of the above acts. So it has a long list, as it's a small list of what we have seen, but there are many other ways of physically hurting others, and all these things will be incorporated in physical violence itself. Okay. Sexual violence is the next common violence which we see in intimate relationship. So it involves rape. Victim was made to penetrate someone else. Non-physical pressure, unwanted penetration, unwanted sexual contact, non-contact wanted sexual experiences. So all these things will come under sexual violence. Do you want to go in detail with all these things, or just push on with the other ones? Are you comfortable with this? So this is a very important thing as such, because many relationship, intimate relationship ends up in sexual act and sexual issues. So we have to be aware about what exactly is going on, and how relations are misinterpreted and utilized mostly. So these are all aspects which are related to sexual violence. Mostly people go for very harsh methods of in sexual violence, and ultimately it becomes a post-traumatic stress disorder for the partner. So these are all things which we have to be aware about. Okay, and we will come to it later if you want. So there is another thing called controlling. Controlling is also a way of dealing with the individual and reducing the mental health of the individual. So we will say that it is a violent behavior itself. So it's basically mostly males have an upper hand in controlling. So usually what they do is keep people from seeing friends, restrict contacts with family of birth, insisting. These are all mostly done in families. After marriage, usually the male member insists for all these stuff. It's called the domestic violence itself. So as a part of that, we can see all these kind of things. Insisting on knowing where she is at all time, ignoring or treating her indifferently, getting angry if she speaks with other men, often accusing her of being unfaithful, controlling her access to healthcare. In fact, it's not healthcare itself. There are many aspects are being controlled by the man who becomes the legal husband. So these are all given by WHO itself, and they have done many studies regarding domestic violence, and they have compared all the details. There is CDC is also the Center for Disease Control and Prevention. It's mostly the research is done by CDC, which is in USA. So they have compiled a lot of factors that has affected or what was happening in families in US as well as in third world countries. So stalking is a pattern of repeated unwanted attention and contact that causes fear or concern for one's own safety or the safety of someone else. So that is called stalking. It includes repeated unwanted phone calls, text, emails, or text. Nowadays, it has cyber stalking is a very pertinent problem, and many people have become victims to cyber stalking. So it's very important to know this aspect also. So this is mostly physical stalking that we are seeing. So leaving cards, letters, flowers, and other items when the victim doesn't want them, watching or following them from distance. So it's like many people who come to psychiatric clinics, they say that they are being followed, they are being watched upon, they are being spied upon. But what we do is we say that it is delusion of reference or ideations of reference. But actually, they may have undergone stalking or other aspects. So we have to be extra careful in these clinical settings, whether the person is really being followed or spied upon. So that is what it is. Approaching or showing up in places where the victim does not want to see them. Sneaking into victim's house or car, damaging the victim's personal properties, harming or threatening the victim's pet, and making threats to physical harm in the harm the victim. So there are many ways of stalking, and these are all some of them. Okay. Psychological aggression is expressive aggressions like name calling, humiliating, and which will shake the morale of the individual itself. Coercive control, limiting access to transportation, money, friends, and family. Excessive monitoring of whereabouts, that is coercive control. Threats of physical or sexual violence, control of reproductive or sexual health, refusal to use birth controls, coerced pregnancy termination, exploitation of victims' vulnerability, like disability or immigration status, all these things. It is mostly seen in developed countries too. Exploitation of perpetrators' vulnerabilities, and presenting false information to victims with the intent of making them doubt their own memory or perception. So it's like deceiving the individual itself. And these are all things which are in the psychological aggression realm. So it is all given by CDC 2016. There is a study which has been conducted in this area, and they have compiled all these aspects. So risk factors for intimate partner violences are individual factors are there, relationship factors, and community factors. There are society factors also along with this. So low self-esteem, low income are all important aspects of when you feel that you are not adequate enough, then you are vulnerable. So that is what happens as a result of the way in which you live, the place where you live, the status that you have. All these things have an important aspect in whether you become a victim to the partner violence. Low academic achievement is another aspect where you undergo abuse, but you are not aware, you are you consider it to be a, because of your ignorance, you consider it to be a part of the, the family life itself, that you get beaten up and disciplined. It's basically disciplining rather than anything else. So that is also a part of, the less exposure that you get, the more you accept many things which are unrealistic and unwanted as such. So young age is another issue. People with young age, they have less knowledge about things and rules and regulations, so they cannot even insist that okay, I need help from the authorities to settle these issues. Heavy alcohol and drug use, many families who where it is like the situations are very bad, like there is alcoholism and there is frequent fights among parents and other things. So that will lead to the neutralization of these negative aspects which have been going, because every day when you see many things, it becomes a part of the family life itself. And people who come from broken homes and other places with disturbed family settings, they have they think that it is a new norm that is prevailing, and beating and physical abuse and psychological abuse all is a part of the the growth process itself. So they don't complain about it. So that is what one thing is. Depression is another important aspect. People with depression, they will tolerate many atrocities without even raising an issue. So that is another thing. Anger, hostility, all these factors, it gives you propensity for being targeted. Antisocial personality traits, borderline personality, that all things we will discuss about it. Antisocial personalities, they think others to be object rather than individuals, and they see people as objects, and they use people as objects. So what happens is they don't care about their the objects' emotions, objects' rights and other things. So they just intrude into that and they just utilize people. So that is what antisocial personalities do, and they don't have any remorse or callous, unconcerned behavior they show. So that is why they are called antisocial, because they don't go by the rules, they don't abide by the rules of the society. So that is why it's an abnormal personality issues that the individual is having. Borderline traits also, they are also very emotional in nature, and so what happens is they are having issues with self-schema, and they have issues with interactions. So what happens is they have like emotional, highly emotional people. They end up threatening others, and they have big emotional issues. So what happens is they are in the borderline because they have the propensity to develop affective disorders. So they are very hard to deal with, and they are very threatening kind of people. They utilize others, and they are not being understood properly, and they make others in a difficult situation. So that is why borderline personality is very important. Prior history of being physically abusive. History can repeat over time. So what you have in history, you can see it because we have a reference point to look upon. So histories are being repeated every here and now. So that is what prior history is all about. Having few friends and being isolated from other people, that is also very important. Pathology emerges when you have when you are being isolated. So you get absorbed in your mind, and ultimately what happens is you create a world of your own, and you start living in that, and ultimately you end up having issues, and you make an internal world and project it to the external world, and that leads to many discrepancies in behaviors, and being judged as so. Unemployment is an important aspect. Emotional dependence. Yeah. So you, sir, do you want to say something? Okay. So emotional dependence and insecurity is also there. Uh, okay. Lack of communication. Yeah, sure. Um, Belief in strict gender roles, desire for power and control in relationship, perpetrating psychological aggression, being a victim of physical or psychological abuse, history of experiencing poor parenting as a child, history of experiencing physical discipline as a child. So all these things are individual factors which are risk factors for partner violence. So what happens is you don't have the repository to deal with issues. When you have experiences, when you have knowledge, when you have the ways, know the alternate ways to deal with things, then you are able to deal with the violence, and you are aware about the violence, and you can start acting upon it and act against it as such. So that is individual factors. Relationship factors are marital conflict, fights, tensions, and other struggles. Marital instability, divorces or separation is one of the major reason. And dominance and control of relationship by one partner over the other. Economic stress, healthy family relationships and interaction. Unhealthy family relationships and interactions are all risk factors. Community factors are poverty and associated factors. When you are in a poverty, what happens is your primary needs are given importance, and so psychological aspects and other things are being overlooked itself. So lack of scarcity of available resources can lead to they become a risk factor for violence. Low social capital, lack of institutions, relationships, and norms that shape community social interactions, weak community sanctions against partner violence, intimate partner violence. So all these things, when you are in a slum, it is a norm to beat the partner. So what happens is there is no, that's a community is sanctioning to or promoting partner violence, intimate partner violence. So that is what the community factors. So we have to understand all these issues and the social aspects, social realm too. Okay. So traditional gender norms is another important thing. So that males are given a dominant role in society, and that can lead to issues with those who are weak. They have to suffer. That is what the societal things are. So that is that also creates a lot of disadvantage for people who are victims. Okay, so hopefully you have it's a comprehensive thing which has been deducted from research studies itself. So that is what it is. This is also done by CDC itself. Okay. Not moving. Okay. So So, what is the consequences of intimate partner violence? So, it is the inability to trust others, fear of intimacy, emotional detachment. So, what happens is the person becomes a victim, and victim stays in the as a victim because the person is not able to trust others, fear of intimacy, and emotional detachment, sleep disturbances, flashbacks. So all these things becomes a after effect of the consequences of partner violence itself. So who is to be trusted, we don't know, and if the person discloses this violent behaviors to some other person, and ultimately the person perpetuator comes to know about it, it becomes a very difficult thing for the individual. So the trust trust is being compromised. Intimacy is when the person gets into a relationship with some other person, they will have flashbacks, and they may end up not having intimacy in relationship. Emotional detachment can be there, sleep disturbances, flashback, replaying assaults in mind. That is part of PTSD, anxiety, depression, symptoms of post-traumatic stress disorder, antisocial behaviors. The victim becomes the perpetuator later. So that is what is called antisocial behavior here. Suicidal behaviors in females, and that can lead to, this abuse can lead to borderline personality traits in individuals. So low self-esteem as another important issue. So the victim, there is fear of retaliation in the victim. So the person remains a victim for a long period of time because of this lack of alternate means of economic support. Usually partner will be the breadwinner, and what ultimately, if the person retaliates, the person may lose the economic support that the person is enjoying right now. Concern for their children. Many families, they live along with the partner because of the concern for their children's growth and their psychological aspects. Many considerate mothers do that. Lack of support from family and friends. So victim may not address all these issues because there is no one to support the individual itself. Stigma or fear of losing custody of children associated with divorce is very high, and love and the hope that the partner will change is the positive thinking is that makes the individual prolong the relationship itself. So that is what the victim is all about. And the individual factors, we have already addressed that. Some of the consistent factors associated with man's increased likelihood of committing violence against his partner are young age, low level of education. We are just deducing it from the studies itself. Witnessing of experience and violence as children, as child, harmful use of alcohol or drug, personality disorders, acceptance of violence, past history of abusing partners. All these things can be the individual factors. Factors consistently are associated with a woman's increased likelihood of experiencing violence by her partner across different settings include low level of education, exposure to violence between parents, sexual abuse during childhood, acceptance of violence, exposure to other forms of prior abuses. All these things. So these are all the cultural aspects which are supporting the violence against women. A man has the right to assert power over a woman and is considered socially superior. A man has the right to physically discipline a woman for incorrect behavior. Physical violence is an acceptable way to resolve conflict in relationship. Sexual intercourse is a man's right in marriage. a man should tolerate violence in order to keep her family together. There are times when a woman deserves to be beaten. Sexual activities, including rape, is a marker of masculinity. Girls are responsible for controlling a man's sexual life. So all these things are actually which are running in the society itself. The thought process which are running in the society itself, which colors and which makes even that females do have all these kind of thought processes. So this makes it a norm, and they just accept it without retaliating. So that is what the norms are all about, belief patterns that we are talking about. The perpetuator, there are many factors that affects the perpetuator itself. So, males, usually the perpetuators are mostly males itself. So there is, biologically when we speak about them, they have testosterone, which is a very, which is a hormone which affects the individual's, flight fight reactionship, and prepares the individual for higher order needs and existence needs. So what happens is there is a innately there is a predisposition for males to be more aggressive, and they are the breadwinners, so they need more energy, and that is why there is a biological predisposition on the part of males to resort to aggression rather than talk it out. Rather, females have more command over the language abilities, and so what happens is males cannot survive or win the battle with females in terms of talking. So what they do is they use their tool sets only have physical things. So what they do is they resort to that. They resort to violence and other things to solve cases. So that is what the norms are. Also, these are all the basis of which norms are being written. So that is why there is written norms and there are unwritten norms also. The unwritten norms goes like this actually. So which one is more favorable for the males, that is being used. So biological predisposition is that there is hormonal variations in individuals, and depending upon the females have a tolerance, higher tolerance to pain and other aspects. So that is why it becomes an obligation for the female to survive more pain and sustain more pain. That's what biologically, and moreover, males have territorial instincts, and they have aggressive instincts as such to keep their territory to oneself. So anything and everything that is under his possession, the person has to keep it like that itself. So for that, the person may use mostly force for dealing with that. So there is a evolutionary component to being aggressive also. The many have personality problems. Personality disorders are more common than never before now. So it's a new norms that has been coming up, and those who have personality issues are increasing in number day by day. So it's basically because of overpopulation and other things that many things have when need becomes high, there will be clashes, and there will be issues with how to deal with it in a healthy way. All these things becomes a problem as such. So people may resort to personality. The personality is being changed by the environmental factors itself. Substance abuse, nowadays substances are freely available for abusing. So what happens is that itself also colors the cognitive framework of the individual, and the person may resort to many aggressive acts under the intoxication of substances. Cultural values are changing with the rapid modernization, and computer, everything has come in. So there is like globalization has had a big effect on the cultural value systems. So things are changing, and it is whether it is changing for an advantageous position, or it is for a disadvantageous position, we don't know about it nowadays. So everything can be used for positive aspects as well as negative aspects. So cultural value systems have changed, and whether it is for good or not, it is researchers have to finalize that. But there are many issues that has happened as a result of change in value system and other things. Observational learning, sure, the perpetuators have always been exposed to all these the benefits of for being aggressive, and mostly it is seen in slums and other places where the perpetuator learns by observation of many successful stories about having a superiority by use of aggression. So perpetrators, they always resort to violence for winning the game. So that is what it is. Being victim of abuse, many of them they may have had abusive relationships when they were young. So what they do is they make it a norm to they have undergone it, so they should transmit it over generations, and many resort to violence because of being a victim of abuse itself. So there are many psychopathologies. There is subsyndromal symptoms in many people, but we don't know about it. The latent psychopathologies can emerge, and they emerge as violent outbursts, and that can also be a part of this violence towards near and dear ones, because they are the only one available for them to have a cathartic effect, or people pent up emotions can be spread to other people by to the near and dear ones. So that is what latent psychopathy. So personality disorders, there are 3 clusters of personalities which we say about when we in clinical settings. So cluster A is odd and eccentric. These people, they mostly they are very confined, and they have less social interactions, and they have some suspicious aspects, and some of them are they are unconcerned about society itself. So they are odd and eccentric. So what happens is many except for paranoid personality disorders, there is other 2 categories. They are lost in their world. So there is no much harm from cluster A disorders. Paranoid personality, on the other hand, yeah, sure, they have issues. They have relational issues. They have delusions are the prominent one. So they have when they get married, their spouses will have a real bad time because of these delusions, and the person may have occasional hallucinations too. So what happens is they may end up abusing their family members because of their pathologies. Cluster B personality disorders have many issues. They are the people who are in the society realm, and they are in the midst of people. They always want to be in the midst of people. They want to be the center of attraction. They have to be. They are very attention-seeking people, and some of them are very proud people. and some of them have self-confidence issues and self-reliance and other things. So what happens is they are more dramatic and they are unpredictable, and these people are who becomes who these people are the people who really the game changers of the cluster B. These people are the game changers. They make all sort of troubles for others who are around them. So cluster B personalities, they have affective components, heightened affective components, and that makes it difficult for them to handle them itself. So cluster B personalities, even clinical psychologists find it very difficult to deal with these kind of people because they have long-lasting emotional turmoils which needs to be dealt with in a longer period of time. So cluster B personality is the difficult one. Cluster C, anxious, avoidant, and dependent personalities, they are okay to deal with, and they have except for anancastic personalities. Anancastic personalities are obsessive compulsive personalities. They can be hard to deal with. Dependent personalities are when a cluster B person marries a cluster C person, it won't be much difficult. If the male is a cluster B personality disorder person and cluster C, the female is a cluster C personality disorder, especially a dependent personality or anxious avoidant personality. Their family life will prolong for some more time than any other. So in that way it goes. Cluster C people, they are very dependable and they are very so what they do is they get hold of their partner and they tolerate all issues because they don't want to get along. So that is what the problem is. So but pathology still remains, and these things has to be sorted out. It's not that it will last for long, kind of. So for male, it is like it's a primal call. Primal call. What is primal call? Primal call is some people, some animals. They when they have the mating ritual, they become more aggressive and they bite and hurt the partner. So it happens as a result of brain. It's wired in us. So we have a mammalian brain in us, which is the lower form of brain. When you become heightened emotionality, your subcortical structures take over your thought process and your reformed brain, and what happens is then mostly a animal-like behavior that is coming from us. So you will have protective instincts and territorial instincts and animalistic instincts when you are into sexual acts. Mostly that is what happens as a result of. So some people resort to violent acts when they have intercourse and sexual, when they engage in sexual acts. So that is the reason behind that. Okay. So okay. There are mostly these domestic abusers have some common nature. That is, they are controlling, they are manipulative, and they believe that men have a preordained right to be in charge of all aspects of relationship, which were mostly there for few 100 years back. 100 years back, it was the real life scenario, but now things have changed. As females are coming into the forefront in many aspects, but still men believe that it's like they have to be in charge and everything should go in their way rather than anything else. Often sees themselves as victims also. So mostly they see themselves as victims. So they say that when there is a power struggle at home, what happens is males get intimidated more fast than females. So they resort to violence because of that. So many go for drug abuse and alcohol abuse because of this power struggle which is happening in the house itself. So these are all some aspects of the thing. So we have to see the both sides, and the victim and the perpetrator changes over time, over a period of time. So the person who is in a victim now will become a perpetrator later. So and vice versa. So these things happens as a in relationship. Everything and anything is possible. So with that note, I think I will keep the floor for open for discussions. Thank you very much for your attentiveness.
Thank you so much, sir, for giving your valuable insight regarding the topic violence in intimate relationships. Let us move on to our question answer section. I request all the participants to drop your queries related to the topic discussed in today's webinar. The
I will
first
start
question.
presenting. Okay.
The first question is by Arina. Is it always women who are prone to sexual violence? Do men face such situations like controlling, stalking?
Okay, that is a very wonderful question, because you have nailed it at the right point itself. Males also are, like victim to many things. But the problem is that whatever which nowadays it's like males, when they get victimized, what they do is they retaliate, and they put the ball into the other person's court, and ultimately they end up becoming more perpetuators than anything else. So they don't have a very good way of dealing with the stressor that they have. Right. So what they do is they just give it back to someone else. So that is what becomes, that is why it becomes like that. So they are victims too, they are perpetrators too. So that is the problem. Females, on the other hand, they have they internalize things, and they try to keep it to themselves. So that becomes another problem. So both of them, when they get abused, what their ways of dealing with it is entirely different, and that is what makes it complicated. So females, they keep it to themselves, and they have a long-lasting issue compared to males who have been, abused. So that's a very wonderful question. Thank you.
Thank you,
for
sir.
asking that question.
Our second question is by Fatima. Lack of communication creates problems between couples. As a psychologist, how we can encourage them to maintain good communication?
Yeah, the basic problem is the power struggle itself. So the power, mostly people want, the partners usually they discuss things, and ultimately what happens is one person will give a solution. So and the other person will challenge it. So that is where the problem starts. And ultimately what happens is the topic gets deviated to many other things also. So over inclusion of many aspects comes into the picture, and ultimately you start with one topic and you end up in many other topics, and ultimately you want to prove that you are in the dominant side rather than in the recessive side. So this happens as a result of that, and then communications becomes skewed, and it becomes difficult to deal with. So that is what happens in many of the families across the world itself. So people start with one topic and they just move to another topics, and they want to get successful in many in the debates that they engage in. So that is what the power struggle is very important in family. So that is where partners becomes difficult. But a healthy couple will deal with it in a proper way, because if you cling on to the topic of concern itself, you can find a solution, and there can be an amicable solution to it also. So it's basically incorporation of many other aspects and many other topics that makes it more complicated and more difficult to deal with. So that is, the communication should be aimed at keeping it more of a fact oriented rather than emotion oriented. That's what it is.
Thank you, sir. It's looked like we have covered all the questions. I hereby request all the participants to fill the feedback form provided in the chat box to receive the e-certificate. Now, I call upon Ria Rachel Ray from second year psychology to propose the vote of thanks.
Am I audible?
Yes, Ria, you are audible.
Am I audible?
Yes, Ria, you are audible.
Gratitude makes sense of past, brings peace for today, and creates a vision for tomorrow. Good evening, everyone. I'm Ria Rachel Ray of second year BSc Psychology. It's my immense gratitude to deliver the vote of thanks for this insightful session on behalf of KCMT and Psychology Department. I thank God Almighty for showering His blessings and allowing us to conduct the successful 13th session of Sci-Hub, the International Webinar Series. I would like to thank our Honorable Principal, Reverend Father Joshi Chiramkuri CMI, for his constant support and guidance. I also thank our Vice Principal, Dr. Varghese Antony, for his encouragement. I extend my sincere gratitude to the resource person, Mr. Harikrishnan Allingal, Clinical Psychologist and Assistant Professor, University College, Trivandrum. I'm sure your words have been really informative and helpful for everyone. Thank you, sir, for your time and effort for this webinar.
Thank you for the time, and thank you for organizing this.
Special thanks to our HOD, Dr. Angel Thomas, for giving us this wonderful opportunity. I would like to thank Ruba for hosting this webinar, Tia for the prayer song, Didin for the guest introduction. I would also thank Luna ma'am and Kriba ma'am for coordinating this session. With deep sense of admiration, I thank Tijo sir for brochure and Jacob from the technical side. I sincerely thank all of you for attending this webinar. Once again, thank you everyone and have a nice weekend. Thank you.
Thank you, Ria. We have come to the end of our webinar. We would like to inform you that our next section of Sci-Hub International Webinar will be on 17th August 6 p.m. by the speaker Asha Sudhir on the topic Screen Smart Parenting. Please mark your valuable presence without fail. On behalf of KCMT, I thank each and every one of you. We appreciate you being here. Have a happy and safe weekend. Thank you.
Thank you.